This report found that one person died from a drug overdose in Australia every 3.5 hours in 2024, which is an average of 7 people a day. Now, overall, roughly about 2,600 people died from an overdose in 2024, which was actually double the national road toll for that 12-month period. Now, this has all come to light after the Drug Research Policy Group, that's Penington Institute, analysed data from the Australian Bureau of Statistics, and this is forming part of their overdose report, which they release yearly. Now, it also found that 80% of those overdose deaths were actually unintentional, and in fact, the age group between 50 and 59 recorded the highest number of unintentional overdose deaths in 2024. Now, it also found that deaths involving cocaine and stimulants, but also opioids, increased in 2024. In fact, deaths involving stimulants increased by 25% in just that 12-month period. Earlier today, the Penington Institute CEO, John Ryan, spoke to the ABC. He's calling for more preventative measures. He wants the state and federal governments to invest more in treatment services, but also harm reduction strategies such as drug education. Let's hear from him now.
I don't think we've got a sort of political commitment to dealing with this problem. Imagine if it was double the road toll, what would the politicians be doing about it? I think they'd be taking it seriously, and we're not seeing that seriousness. We put most of our effort into law enforcement. We put less than 2% into safety approaches or harm reduction. So the government's, the federal government is really banking on law enforcement, but it's a health and social issue.
A health department spokesperson says the federal government does provide significant investment in a range of different programs which are aimed at minimising the harms associated with drug and alcohol use. Now, what you've heard today is just a snippet of the full overdose report, which will be released later this year.